Hi, and welcome to Michigan Matters. We're ringing in 2026 with the focus on our health as we talk to folks in the know about it. First up, Dusty Mysen, a father of four diagnosed with pancreatic cancer who defied the odds and is cancer-free 5 years later. We'll talk to him and his doctor about it. Then CPA Karen Akori, who created a healthier, all-natural salad dressing called Drench, is growing her business from Detroit. She's here to talk about it. And as many of us have vowed to get healthier and hit the gym more often, we'll talk to a doctor who has advice on how to do so safely. It's a show about our health and well-being. Let's get started.
From CBS Detroit, this is Michigan Matters with Carol Kane. Michigan Matters is brought to you in part by Cure Auto Insurance.
And we're pleased to welcome Dusty Mysen, who was diagnosed with pancreatic cancer and is cancer-free today, 5 years later, and his physician, Dr. David Kwan from Henry Ford Health. Happy New Year's, gentlemen. Great to have you with us to kick off the show.
Thanks for having us.
Thanks for having us.
So, Dusty, I want to hear a little bit more about your story. You look at the picture of health, by the way.
Thank you.
You're father of four. You live in a healthy life, and then you get this diagnosis. Talk about that moment.
Yeah, I was 46 years old, healthy, really blessed, great family life, good career, and I started to have some abdominal pain in 2020. It took me a little bit to go to the doctor. I procrastinated a little, and when I went in, my gallbladder had failed, so I had a fairly simple surgery to remove that, but I did not get better. I actually got significantly worse. I woke up jaundiced one morning.
Oh my. And
went into the ER, and after multiple tests, they found out that I had a tumor in the head of my pancreas. So I started going through chemotherapy, and did that for a few years, had a few attempted surgeries, and really just went through the full cancer process of fighting it, and ultimately had a surgery that was able to remove the tumor.
You had the big surgery, which took everything. So Dr. Kwan, how is it that Dusty defied the odds? And is everybody candidate for the type of surgery that he had?
Yeah, so interestingly enough, about 80% of the patients that are diagnosed with pancreatic cancer are found in late stages, and so we can't actually do surgery. Dusty was one of the few that actually had a tumor that we thought we could safely resect. Okay. And so after, I think, multiple attempts, we were able to finally get it out.
So pancreatic cancer is one of the most lethal cancers. I know Aretha Franklin passed of it. L. Brooks Patterson, who was a regular on the show for years, had it. And he was diagnosed, and as I was reading more about it, 3 months survival after being diagnosed is common to no longer be with us anymore. Why is it that the survival rate is only 3 months after this?
Yeah. First of all, there's different types of pancreatic cancer, and the one that we usually hear about on TV with Brooks Patterson or even Alex Trebek from Jeopardy, they had
Patrick Swayze, the
Patrick
actor.
Swayze,
Yeah.
Michael Landon even. We can go back to the diagnosis of what's called adenocarcinoma, and the 5-year survival rate for that particular type of pancreatic cancer is about 11 to 12%. Aretha Franklin, as an example, had a different type of pancreatic cancer that was called a neuroendocrine tumor, and she was able to get about 8 to 9 years of survivability with that. And so you have two different types of cancers acting differently in the pancreas that change the diagnosis and prognosis.
What is a pancreas? What is its purpose?
Yeah, the pancreas has two major purposes. One is to regulate your blood sugar, so it produces insulin. And works with pancreas also to release another enzyme called glucagon. So it helps regulate your blood sugars, but it also serves as a different function to produce the digestive enzymes or acids that help with the digestion of your food.
And Dusty, you come from a family, you have 4 children. I don't know what their age ranges are, but what's the range of the ages?
My oldest is 26, just turned 26, and my youngest is 13. Then I also have a 20-year-old and a 17-year-old.
It helps keep you young, having all these different ages. You're also participating in Ironman. I mean, you're doing extremely well.
Thanks to Dr. Kwan, I am very healthy. I run regularly. I hit the gym regularly. I actually did that through my whole cancer journey. I feel that really helped keep my body ready leading up to the surgery.
Right. So, and you mentioned that there aren't a lot of symptoms oftentimes here. So what can someone do to make sure that their pancreas is healthy and doing what it can do? Is there like a blood test or something you can take?
Yeah, unfortunately, there is no blood test that will lead to the early diagnosis of pancreas cancer, and that is something that everyone is actively working on. But the symptoms generally are what Mr. Mysen suggested, is just new onset abdominal pain that's sort of right underneath the breastbone, but is sort of deep towards the back, unintentional weight loss, and the later signs will then be your eyes turning yellow or your urine or your stool patterns changing significantly.
Oh boy, okay. Well, we're going to talk about that and some other things involving some research into this, but we're going to take a quick break. We'll be back with more Michigan Matters after this. And welcome back to Michigan Matters. We're talking with Dusty Mysen, who was diagnosed with pancreatic cancer, but is cancer-free 5 years later, and his physician, Dr. David Kwan, who has helped him in immense ways. And Dusty, as a result of this, you're cancer-free now 5 years later. You had many surgeries, but the major surgery, it's obviously working. Have you changed your lifestyle, or do you have to do any preventative things as a result of all this?
Yeah, I currently get CT scans every 6 months to monitor my situation, and then I continue to work out, eat healthy, but from a medical standpoint, it's basically 6 month scans to monitor my pancreas and surrounding organs.
So, Dr. Kwan, does pancreatic cancer, does it run in families? Is it genetic or what?
Yeah, that's a great question. There is a genetic component to pancreatic cancer, and so when you are newly diagnosed with pancreas cancer, it is essential for the patient to get tested to see if there are any identifiable mutations that are passed down from generation to generation.
Yeah. All right, you have 4 children. Are they going to be tested on this too?
I was tested, and I do not have the
so you
genetic,
don't have that,
very
okay.
Fortunately.
Okay. So this actually is not that common a cancer. I read the stats. I think it's 3% of all cancer diagnosis is pancreatic cancer, yet it's a high percentage of cancer deaths, particularly because it's discovered so late and there's nothing that can be done here. Are we any closer to, first, are my stats accurate?
Yes.
Okay,
very
all right. Are we any closer to finding a cure?
I think the pancreatic cancer is a very difficult cancer, and we are making progress. I don't think we're quite there for a cure, but in the horizon with research, there are really promising pathways that we are better understanding that we hope to translate into clinical care over the next couple of years.
And I know Henry Ford Health is very aggressive in cancer, fighting cancers, has variety. You run the pancreatic cancer unit or division. How long has that been up in existence?
Since 2013, we've been specializing in pancreatic cancer care, and in 2018, we received a transformational $36 million gift to really emphasize the research component of pancreatic cancer.
That's what I'm also wondering too, because we know with research dollars the battle for, and pancreatic cancer not being as common, is this making it tougher to raise money to do further research into it?
I think across all cancer, there is difficulty with raising funds, and this is why we need to really advocate for public awareness, but particularly with pancreatic cancer, because it is so rare compared to lung cancer or breast cancer, there generally is not as much emphasis on pancreatic cancer research, and we strongly advocate for equal voice.
You specialize, this is your specialty. Why pancreatic cancer? Curious. Why did you focus on this?
Unfortunately, the survival rate is quite low, and to participate, to be involved in the change of this field where we can have more Mr. Mysens surviving is what drives me every single day to come in and work and try to find new things.
And because Detroit is heavily African American, and we've had other doctors from Henry Ford, other places on talking about diseases being more pronounced in the African American community, people of color. Is that true as well with this type of cancer?
Unfortunately, it is true with pancreatic cancer. So when we look at disparities, is people of color generally present later with more aggressive disease, and as a result, we've seen that generally their survival is not as good as it could be. We've worked really hard to remove the social determinants of health barriers, and in doing so, we believe that we can improve outcomes.
So is there anything someone can do besides the usual, eat the right foods, work out every day, and don't drink any beer, wine, anything like that? Is there anything else someone should be doing, being mindful of this? I mean, and Dusty, you talked about your own change of what you did after the fact. Anything you would tell somebody, having gone through all this, that you personally?
Oh, I don't know. I think living a healthy lifestyle is regardless of our cancer situation, is important. I guess because I delayed a little bit at the beginning, I was still fortunate enough to find it early enough. But I would always recommend, if something doesn't feel right, to trust your intuition and see your doctor. We all tend to procrastinate that sometimes.
Yeah.
I did it in this case. And if I would have, I was fortunate that I eventually went in and they were able to find it early enough.
Yeah. When you first started having symptoms, had you gone on, would it have made a difference in his course of action that took place then over the time?
I think, how long was it before you had surgery?
From diagnosis, about 4 months.
And perhaps we would have gotten into the operating room a little bit sooner, but again, we were fortunate to find it early enough that we could intervene.
Well, I want to thank you both for sharing your story. It's your story, and you are a big part of that as well. And is there anything else you would tell someone watching this who is concerned about if they're having any issues with their abdominal, whatever, what to do?
Yeah, I really liked what Mr. Mysen said, is you have to be an advocate for your own health, and if something doesn't feel right, you really have to work with your physician to continue to pursue and to seek the answer. I think we're here 5 years later is because he actually did take a proactive approach. And if something unfortunate happens, like a cancer diagnosis, is why he's also sitting here, is his mental space is correct. I think his attitude was fantastic. And when you have that combination with good health care, this is, I think, what we see.
Have a good outcome.
Absolutely.
Take matters in your own hands.
Yeah.
There we go. Thank you both so much for being here. Continued good health. Thank you for being in and doing all you're doing to help the community here again. And Happy New Year to you both. And keep it right here. We're back with more Michigan Matters after this quick timeout. And welcome back to Michigan Matters. We're now joined by Karen McCurry, who's a CPA by training, who created Drench, an all-natural, healthy salad dressing, I think 6 years ago, that's taken off and sold in thousands of stores around the country. Happy New Year, and congratulations on your entrepreneurial success.
Thank you so much. It's so great to be here.
It is great to be here, too. Well, it's amazing to me because you are a CPA. This is not your thing, but how did you decide to create a salad dressing? And the second question will be how it got in the store, but why did you create a salad dressing?
So I was making what I thought was a healthy salad for my family. I ran out of the dressing, the conventional store-bought dressing I was using, and I thought to myself, oh, I could save myself a trip to the store. I'm sure I have some ingredients that I can just throw in. And as I was reading the ingredient label, I was like, oh my God, I don't have disodium inosinate or sodium benzoate or titanium dioxide. And I Googled titanium dioxide.
Yeah, what is it?
I learned it was a whitening agent used in industrial paint and sunscreen. I'm like, oh my gosh, why are we eating this? Why is this in our food? So at that point, I decided I'm never buying dressing again. I'm going to make my own.
And so you created this. And so creating a salad dressing that's healthier for your family to going to a product that's sold in thousands of stores is a giant leap, a tough one to do by any stretch of the imagination. How did you go from after creating this to get it into any store?
Oh gosh, yes. It was a learning process, I have to say, because I knew nothing about this industry. So I did a lot of research and then just learned how, it has to go through testing and what you make at home, you can't necessarily bottle. So I had to make a lot of adjustments. And friends and family just loved it, and they encouraged me the whole way. And I just did it through a grassroots effort. I knocked on doors, went to stores, and said, "Hey, I have this product."
Did you go to farmers markets too?
I did.
Yeah, that's a big entry point for a lot of people. So you're now creating this. It's made in Detroit.
Made in Detroit.
How many
right
employees do you have? And talk about the imprint, sales, and how many states your product sold in?
So we have about 15 employees, and it's made right here in Michigan in Detroit, and we're based out of West Bloomfield. And we are, this year, we can say we're in over 4,000 stores nationwide in 49 states. So if you're here in Michigan, you can get it from Plum Market, Meijer, Whole Foods, Bush's, Westbourne, Nino Salvaggio, and then go out of state, you can get it at Sprouts, Albertsons, Wegmans in New York. So that's really exciting to be able to see my product on the shelf.
Well, and as part of this healthy transition with the salad dressing, this was part of your own personal health story too, right? That was kind of a motivator for you, right?
Yes, absolutely. As I was launching my brand, I learned that I had breast cancer. So it was an early pre-stage. It was DCIS, and I really had to pivot and make it a priority and realize more than ever it's more important now to make sure I'm eating clean and making sure I know what I'm putting in my body and looking at ingredients.
And so you've started with the salad dressing, but I know you've got other products here we're seeing on the table here, sauces and such. So how do you see, are you going to be like the Mrs. Fields of salad dressing? Is that your goal here?
Yes, I would love to Drench to be a household name, and we just want to make it available to everyone, so everyone has clean options. Yeah. They're so delicious. They're free of the most common allergens, which is so nice. So gluten-free, dairy-free, nut-free, fish-free, and most of them are egg-free. And we don't use any seed oils. So there's so much controversy with seed oils. Now you see it all over social media. It just causes inflammation, and so many gut issues. So all of our dressings are seed oil free.
Okay, I have to ask this. What is the most popular salad dressing that you sell?
Oh, so it's our Mediterranean lemon. This is our #1. And this was actually inspired by my late mother-in-law. I had the best mother-in-law. Not many people can say that. But she was like a best friend to me. And after she passed, God rest her soul, my family missed her dressing. So I spent some time recreating it, because back then, little Lebanese women, they did not measure. They were just throwing in, a little here, a little there. So yes, and it turns out to be our #1 dressing. Yes.
How do you test flavors and sauces? I mean, do you have like family and friends as your guinea pigs? Kind of like, okay, here's different ingredients. What do you think? I mean, how do you do that?
Well, it starts with me and actually my son, who has a really good palate as well. And we create them, and then we get feedback. And the great way to get them is family, friends, and the farmers markets, doing demos. We get firsthand, feedback.
And I know you recently met Kevin O'Leary from Shark Tank, for those Shark Tank aficionados, which I bet I'm one of them. You had a chance to meet him, and I know there's a thought you might appear at some point in time on that show and pitching your product, right?
Yeah, so I was part of the Goldman Sachs 10,000 Small Business Program, and that affords you this amazing summit that you can attend every few years, and you meet so many celebrities, and it's an incredible opportunity. And of the 2,100 attendees, they selected 5 to meet with Kevin O'Leary. So I was so blessed to be able to meet with him.
Did he like your salad dressing?
Yeah, well, I presented them to him. He didn't try them on the spot, so we're hoping.
Hoping to get an invite back to the show. Well, let us know if you make it in there. But I want to thank you so much for being here and sharing your inspirational story. And my gosh, it's sort of like from an idea to store. That's an amazing thing. So congratulations.
Thank you so much. And if you would like to purchase our products, they're available in over 4,000 stores, but also at drenchitclean.com. And if you can follow us on Instagram, that would be great. We always post a lot of recipes.
It's a social media world today.
It is. It is. We're at Drench Dressings and also Drench Dupes.
All right. Thanks so much for being here.
Thank you so much. It's been such a pleasure.
Great to see you, too. And keep it here. We got a little bit more Michigan Matters to come. And welcome back to Michigan Matters. We're talking with Dr. Robert Maynard, who is with Henry Ford Health. And your specialty is?
Cardiology.
Cardiology. Okay, so we're here to talk about health, and we know we're coming out of the New Year's resolutions time, a couple days in here. I'm going to guess some folks maybe broke those vows already, but to do a little more exercising and focusing on their health. As someone who with expertise in heart health, and all of this is so interconnected, what advice would you give to somebody who's just starting out, maybe not a couch potato, but they just want to hit the gym a little more often?
Yeah, it's very important to kind of realize where you are, and some people are more sedentary. And so if that's your situation, you're going to want to start slowly and increase your activity gradually.
So when you start slowly, okay, let's just take a hypothetical. You have somebody who's 50 years old. He or she has not been doing much. They want to start. So a lot of times, particularly, we know people buy gym memberships. I think I read that number one state. It's the whole in January, more memberships are sold because I'm going to do this, and then by the end of it, drops off totally here. So maybe someone is not cut out to go to a gym, but they can do stuff at home, right?
Oh, absolutely.
Yeah.
There's opportunities to do anything around the house. It could be something as simple as going up and down the stairs. It could be finding a place that's convenient for you to get some time walking. It might be with a spouse, an animal, a kid, a friend group. There's just various options out there to get active. It's really about getting active and getting more time doing things rather than being sedentary. That's a very important part.
I read health journals, and there seems to be some conversations, not journals, but magazines about health and fitness and things you should or shouldn't be doing. It's conversation about doing cardio, lots of aerobic kinds of things versus walking in something a little slower pace, a little more. What's the right mix for something like that for somebody who is that profile, hasn't really done much, is just getting back into the swing?
Yeah. So there's some guidance out there from like larger bodies, so American College of Cardiology. So we like to try and get 150 minutes of aerobic activity a week if we can. If it's more vigorous, like if it's more of a higher level activity, maybe 75 minutes is the guidance for this. And then the other thing I'd bring up would be incorporating some sort of resistance training with it. So at least 2 times a week, getting some tension on your muscles, lifting some weights and such.
How long? Like, are we talking about doing this for 10 minutes? Is this something to do it for a half hour?
Yeah. It's 10 to 15 minutes is fine just to get going. And I think what's going to happen is as you acclimate to this process and as you gain more experience and confidence, you're going to increase that activity, and that would be good for your overall health.
One of the things Americans seem to have is sleep deprivation. People aren't sleeping. They're worried. Maybe they have sleep apnea. How important is sleep to our overall physical and mental health?
It's extremely important process. So if you go back and you look at some of the guidelines from, like, say, lifestyle medicine, or American Heart Association has, like, Life's Essential 8. Each of those bodies have identified sleep as one of those amazingly important constituents of good health and wellness. So sleep apnea is something that a lot of people have that is under-recognized. We certainly see people coming into our institutions having cardiac problems that have not been screened for or identified. And when they do take care of this important health issue, they start to have other improvement across other spectrums, like their blood pressure, their risk for cardiac arrhythmias, and then overall metabolic health improves as we get better sleep.
We're also seeing more of an incidence of heart disease affecting younger people.
Absolutely.
You hear about people in their 20s having issues suddenly, which kind of, is it the fact that we're on our computers too long, we're not getting out and moving around?
It's probably part of it. I mean, there's maybe many different things, but whether food choices, food quality, the fact that we're sedentary, like it's the new smoking, right? Those are important things. Obesity, if you look at lots of the problems we experienced or we saw in our older populations, they're being moved forward because of the level of obesity and metabolic.
What's the one piece of advice you'd give somebody middle age who's trying to get healthier and having a hard time getting started? We're about to wind this down, so what's the one piece of advice?
I would say that if you can find a support network, whether it's a healthcare advocate or a good friend or family member, if you have someone that you can have confidence to do this with together, I think it's going to be very helpful. You're going to be more successful. And
that's what we want. We want people to be happier, healthier, and living a longer life here. Well, Dr. Maynard, thank you so much for being here. Appreciate you being here. Happy health to you. Happy 2026.
You as well. Looking forward to it.
It's going to be a busy year. That much I know. So again, thanks for being here. And thanks to you at home for tuning in. Enjoy the rest of your day. We'll see you next Sunday for a little bit more Michigan Matters.